Very good evening to all of you. Today we are going to do the live MCQ challenge of pathology. This pathology is a very important subject as far as NEET PG is concerned. It has about the questions 25 questions MCQs will come from here, and the sound knowledge of pathology will also help you in solving many questions of medicine, surgery, and pediatrics, and sometimes even PSM also. And skin questions can also be solved with the help of deep knowledge of pathology. So let's begin with Michaelis Guttman bodies are seen in Michaelis Guttman bodies are seen in A. Xanthogranulomatous pyelonephritis, B. Malakoplakia, C. Nail patella syndrome, D. None. Now let us know what is Malakoplakia. Malakoplakia is a variant of cystitis. It is related to chronic bacterial infection. बार बार बैक्टीरियल इन्फेक्शन हो रहा है तो mostly by Escherichia coli or occasionally by Proteus species. This Malakoplakia is characterized by unusual appearing macrophages. Macrophages कुछ अलग दिखते हैं and giant phagosomes. Phagosomes are giant. It points to defect in phagocytic or degradative function of macrophage. जो macrophage का degradative function है उसमें defect है इसमें. It is a peculiar pattern of vesical inflammatory reaction characterized by soft yellow, slightly raised mucosal plaques. इसमें ना there are mucosal plaques which are soft, yellow, and they are slightly raised. Histologically, it is characterized by infiltration with large foamy macrophages. Histology में देखेंगे तो there will be large foamy macrophages and occasional multinucleate giant cells and interspersed lymphocytes. So these Michaelis Guttman bodies are seen in B. Malakoplakia. Now, so Michaelis Guttman bodies are laminated, mineralized concretions, laminated mineralized concretions resulting from deposition of calcium. कहाँ पर? In enlarged lysosome. They are typically present both within the macrophage and between the cells. They demonstrate positive results using PAST-10. So the correct answer here is B. Malakoplakia. Now DIC. DIC जो है बहुत important है. DIC means disseminated intravascular coagulation. Any question can be asked in DIC from medicine and also in pathology. ये acute promyelocytic leukemia, B. acute myelomonocytic leukemia, C. chronic myeloid leukemia, D. autoimmune hemolytic anemia. So this DIC is associated with promyelocytic leukemia, that is acute promyelocytic leukemia. AML M3 constitutes 5 to 10% of all cases of AML. The leukemic cells of these types of anemia are hypergranular. Granules of these leukemic cells are promyelocyte contain thromboplastin-like material resulting in widespread disseminated intravascular coagulation. Majority of M3 cases demonstrate a reciprocal translocation involving chromosome 15 and 17, that is known as T15 and 17. So the correct answer here is A. acute promyelocytic leukemia. Liquefactive necrosis. Liquefactive necrosis is seen in A. heart, B. brain, C. lungs, D. spleen. Of course, liquefactive necrosis is seen in the brain, so correct answer is B. Please click the link in the description box to join the ultimate NEET PG Breakthrough Blueprint event. It is a 2-day event covering all the significant topics in all the 19 subjects in a holistic manner. It will give you a huge advantage in your PG preparation. The first 10 students who click the link in the description box will get this absolutely valuable masterclass absolutely free. And if you join the WhatsApp group, you can get a lot of things in this WhatsApp group till you clear your NEET PG exam with flying colors. So let's move to the next question. Flare in triple response is mediated by A. Axon reflex, B. Arterial dilatation, C. Histamine release, D. Local hormone. What do you think is the correct answer here? A. Axon reflex, B. Arterial dilatation, C. Histamine release, D. Local hormone. It is axon reflex. Cystic medial necrosis is seen in A. Marfan syndrome, B. Friedreich's ataxia pattern, C. Down syndrome, D. Kawasaki disease. This cystic medial necrosis is seen in Marfan syndrome. Cystic medial necrosis (CMN) is a disorder of large arteries. It is characterized by accumulation of basophilic ground substance in the media with cyst-like lesions. Hence, it is called. इसीलिए इसको cystic medial necrosis कहते हैं. It is known to occur in certain connective tissue disease such as Marfan syndrome, Ehlers-Danlos syndrome, and anuloaortic ectasia, which usually results from degenerative changes in aortic valve. Cause of constrictive pericarditis is are A. TB, B. SLE, C. brucellosis, D. A and B. It is both TB and SLE. In a cell death, myelin figures are derived from A. Nucleus, B. Cell membrane, C. Cytoplasm, D. Mitochondria. Is cell membrane. Enzyme that protects the brain from free radical injury is A. Myeloperoxidase, superoxide dismutase, C. MAO, D. hydroxylase. It is superoxide dismutase. Fat necrosis is common in A. omentum, B. breast, C. retroperitoneal fat, D. all of the above. This is seen in all of the above. In apoptosis, cytochrome C acts through APF1, BCL2, FADD, TNF. It is APAF1, which is activated for nuclear fragmentation in apoptosis. Caspases APF1 oxygen free radicals on. It is caspases. Annexin B is a marker for apoptosis, necrosis, atherosclerosis, inflammation. It is apoptosis. Which of the following markers specific for gastrointestinal stromal tumor? It is CD117, which is specific for gastrointestinal stromal tumor. The correct option here is A. Multiple epidermoid cysts are seen in A. Turcot syndrome, B. Gardner syndrome, C. Pidgeger syndrome, and D. Familial polyposis coli. It is Gardner syndrome. Gardner syndrome include adenomatous polyps of gastrointestinal tract. So the correct answer here is B. Gardner syndrome. The feature of Crohn's disease are all lymphoid hyperplasia, skin lesion, transmural involvement. So correct answer here is except lymphoid hyperplasia. Please click the link in the description box to join the 2-day ultimate NEET PG breakthrough blueprint event covering all the 19 subjects in a holistic manner. If you are an in-service candidate or a regular candidate or a repeater candidate preparing for the NEET PG, it is for all of you. It will help you to revise for your exam in a better manner. Female is affected, male is not. Disease is autosomal dominant. What is the chance in children? A 50% affected, B 25% affected, C 75% affected, D all affected. This 50% affected. The inheritance pattern of familial retinoblastoma is A autosomal recessive, autosomal dominant, X-linked recessive. It is autosomal dominant. Male to male transmission is seen in A autosomal dominant disease, autosomal recessive disease, X-linked dominant mitochondrial. Male to male transmission is seen in autosomal dominant disease. See, X chromosome is not transmitted from father to son, and mitochondrial disorders are always maternally inherited. Autosomal recessive disorders can be transmitted from father to son, but only if the mother is also affected or at least she is a carrier. If only male is affected, autosomal recessive disorder cannot be transmitted to the son. Autosomal dominant disorder can be transmitted in any direction, from father to son or daughter, from mother to son or daughter. So the correct answer here is A, autosomal dominant. Which is not a feature of Down syndrome? Clinically pigmented birthmark. C. Hypotonia. D. Respiratory tract infection. See, Down syndrome is very important from medicine point, pediatric point, and as well as pathology point of view. So the correct answer here is B. Pigmented birthmark. The clinical features of Down syndrome include mental retardation, short stature, craniofacial brachycephaly, epicanthic fold, protruding tongue, small ears, upward sloping palpebral fissure, mongoloid slant, strabismus, nystagmus, brush-fed spots in the iris, fifth finger clinodactyly, single palmar crease, and wide gap between first and second toe. Congenital heart disease common AV canal and ASD most common VSD, PDA, tetralogy of Fallot. Anal atresia, duodenal atresia, Hirschsprung disease, annular pancreas, increased incidence of leukemia. So the correct answer here is pigmented birthmark. Lines of John occur in A. Postmortem clot, B. Infarct, C. Embolus, D. Coralline thrombus. It is coralline thrombus. Anemia with reticulocytosis seen in A. Hemolysis, B. Iron deficiency anemia, vitamin B12 deficiency, aplastic anemia. It is hemolysis. Maximum spirocyte is seen in A. Autoimmune hemolytic anemia, B. Vitamin B12 deficiency, aplastic anemia. None is autoimmune hemolytic anemia. The anemia associated with leukemia is A. Iron deficiency, B. Megaloblastic anemia, C. Myelocystic, D. All. It is myelocystic. Chemotaxis is mediated by A. Histamine, leukotriene B4, C5A, leukotriene C4, and C3A bradykinin. It is leukotriene B4, C5. Hyperimmune IgA syndrome is also called A. Job syndrome, Viscott-Aldrich syndrome, Chidiac-Higashi syndrome, D. Diageos syndrome. It is Job syndrome.